Hello everyone. Today we're back with Sharon at Riverview Face and Body Aesthetics, and we're here for her 4-month follow-up from her liposuction and tummy tuck that was done in the office. We wanted to give her a chance to just talk a little bit about her experience, her healing up to this point, any difficulties that she encountered, kind of expectations, as oftentimes our patients will ask us, well, what is it like to have this procedure? And for someone who hasn't, gone through it myself, I can give them just what my other patients have told me. But it's so nice to hear from, a patient of ours who's had a positive experience about their kind of healing journey. So just to provide a little background, Sharon had lost a fair amount of weight after a gastric bypass procedure, and she was kind of stuck with this loose skin in her lower abdomen, right?
Gastric bypass?
Or no, just a weight loss, right?
Weight loss.
Yeah, without gastric bypass.
Yes.
Oh my, so she had lost weight even better on her own without gastric bypass surgery. Not that there's anything wrong with people that get gastric bypass surgery, but obviously it's even better if people can lose that weight on their own. Thank you, I stand corrected. So yeah, Sharon, if you wouldn't mind just talking a little bit about your experience here at the office, what it was like on the day of the procedure, and then in the post-operative period, and then up until the present, and just giving the highlights, because we want it to be real and genuine.
Okay, hello everyone. I'm going to start back a ways. I was obesely overweight for many, many years. Did lose 106 pounds back in 2019. After maintaining it for over a year, then I came to the office to find out what I could do about the skin that was falling over. And even though I had lost weight and I felt great, getting my clothes on, I'm pushing all this skin and tissue around. And even though I'm 75 years old, I'm planning to live a really long life. And I thought, if I live to be 100, I don't want to push this stuff around for 100 years, or for 25 more years. So anyway, I came and met the doctor and the staff here who are wonderful, and had the procedure done. One thing I wanted to say though is I was grateful that the office was willing to see me as a patient, because I've had friends who live an active lifestyle even though they're seniors, and they were told they couldn't have this procedure because they were too old. Well, here, ageism isn't happening, and if a person is healthy and willing and there's no medical reason not to have it done, you can have the procedure done. And the day of the procedure, naturally I was nervous, afraid, but I came in and the staff was wonderful. The good news is that you're asleep for it. When I came to, I have a really good friend that lives here in Minnesota. I stayed with them for 4 weeks. And so I had people to be there with me when I needed some extra care. I live alone normally. But anyway, the morning after the procedure, when I looked in the mirror, I was grateful. And I have not regretted it one day or 1 minute since.
Wonderful.
Yeah, because the recovery is long. So the good news for me again was I had another friend who had had a similar procedure done, and she told me, she said, it's going to take a long time to heal, and 8 months to a year before you feel like you did before the procedure. It's a major thing, but I didn't have any pain that I didn't expect. As far as the pain medications, the prescription is given to you if you need it. I think I took the strong medication 2 days, maybe 3 days, and then for me, I was fine with my Tylenol after that. So you don't need to take it real long, or I didn't. I didn't rush my recovery. I did what I could do. I was very slow the first 2-3 weeks, shuffling along, but I could climb stairs the same day I had the procedure and that sort of thing. Slow movements, but I thought the recovery was not harder than I had expected. And so now I'm 4 months in. It's exciting to look in the mirror and watch myself shrinking as the swelling goes down. Like I say, I haven't regretted it ever, and I doubt that I will, because having been so heavy for so long and looking down and it's flat. It's like a miracle.
No,
And
that's-
so I'm just grateful that I had it done. The other thing too is for people who have been really large for a long time, some of the things about being a healthy weight, and it's like when I get on an airplane to fly, I don't have to worry anymore. Oh, is the seatbelt going to fit around me, or do I have to be embarrassed and ask the stewardess for the extension? I mean, all those things I don't have to deal with anymore. So I highly encourage people to get to a healthy weight, no matter what it takes. And if you have a lot of skin hanging around that you're pushing around that you don't want to have, I highly recommend coming here to have the procedure done.
Well, thank you so much for that positive endorsement and that you've had a positive experience. Like she said, the healing after any kind of cosmetic surgery, it takes time. Now, it doesn't necessarily limit what people can do, but for those first like 2 to 4 weeks, we usually say no heavy exercise, no activity, just kind of let your body heal. But then, like you said, it's still contracting and healing now 4 months, even at 6 months and a year. The body, the collagen, the contraction continues. But yeah, we are blessed that you trusted us with your body and life here, and we're happy that we were able to help and treasure the information that you've provided for our patients.
Well, thank you. It's been great. One other thing I did want to say is I immediately started walking because doctor said that it wouldn't hurt me, so I've been walking pretty much since the beginning. I'm now swimming. For me, I'm just so pleased with the outcome, and I'm just like, oh, am I going to hurt myself by doing something? So I need to give myself permission to do some more things. So I plan to go back to golfing here next week, and I played pickleball before, which I haven't done since, but I'm going to just try it, and I believe if it doesn't feel right, I'll stop.
That's wonderful. Yeah. Well, thank you so much, Sharon, and for traveling back to Minnesota, and also just for updates on your continued healing. We plan to see her back again at about a year or roughly around there. If anything comes up, obviously you know who to call.
Yes, thank you.
All right.